Ready?
Yes, ma'am.
Okay, so if you've read and understood considering it critical care scenario, please tell me how are you going to manage this patient now?
Considering the scenario, I'll manage the patient according to the care of critical ill patient protocol management
Yes.
policy and ABCD approach. I'll check
Okay.
the air, breathing, and circulation. Here I'll check the pulse, blood pressure, capillary refill, and urinary output, and also check the abdominal condition because in the laparotomy
Okay.
and the wound also. And I'll manage the patient in ITU with the multidisciplinary team approach, and I'll give the humidified oxygen of the patient and consider the adequate ventilation by invasive or non-invasive ventilation, and I manage the underlying cause and that give the check the drug chart of the patient. Here the morphine is given, so I'll consider the patient may having the morphine overdose, so I'll give the morphine antidote of the patient, ma'am.
Okay, what is the antidote of morphine?
It's a naloxone.
How much would you give?
Initially, I'll start 0.42 milligram IV, then I observe. If no response, I'll give again 2 to 3 minutes later, and maximum dose 10 milligram IV.
Okay. There is a term written respiratory depression in the stem. What do you understand by this term?
Respiratory depression because the patient having a morphine overdose, the
No, but
respiratory
what is
system
the
is not functioning while patient may have the respiratory, yes, a respiratory failure. The respiratory acidosis may develop patient.
okay. How many different types of respiratory
Respiratory
depression
failure.
there are? How would you
Two
classify
types.
it?
Two types, ma'am.
Yes, please tell us.
Yes, ma'am. Type 1 and type 2 respiratory failure.
Okay. All right. Which type is this one?
A patient having the type 2 respiratory failure.
Yes, please explain what is type 1 and what is
Yes,
type 2 respiratory
yes.
depression.
Okay, ma'am. In type 1 is the ventilation perfusion mismatch. Here the flow of the air moves in and out of the lungs, cannot mess with the flow of blood in the lungs. That is the type 1 respiratory failure. The cause is pneumonia, pulmonary embolism, or pneumothorax. And the type 2 respiratory failure is the inadequate ventilation of the alveoli, and here the body produce more carbon dioxide, cannot expel out. There
Okay.
will be hypercarbia.
First
Yeah.
of all, please
Yep.
tell me
Yes.
what are the signs and symptoms you'll observe in this 60 years old post-operative patient that you'll determine that patient could be suffering from a morphine overdose?
Yes, ma'am. And the patient may having the nausea, vomiting, uh,
Patient,
const,
okay. Look,
confusion, headache.
patient is in
Oh,
this
yes,
state.
yes, ma'am.
Now tell
Respiratory
me.
system, respiratory rate is shallow, not
Okay.
rapid.
And there'll be
And
CNS depression as well.
yes, yes, ma'am. The
More.
confusion, patient have confusion.
Okay. Confused.
The
And
skin
more.
rash may develop, hypotension,
If you'll examine the eye, actually, I want you to tell me yourself. How would you find?
meiosis.
Yes. Okay. Right. And then please tell me what labs are required for you to establish your diagnosis of morphine overdose.
Yes, ma'am, I'll do the ABG.
Okay. Uh, Arterial blood gases.
Yes,
How
ma'am.
would you interpret it? How do you expect it to be?
Yes, ma'am. The pH would be less than 7.35 here. The oxygen level either normal or below, and the carbon dioxide pressure would be raised.
Okay. And what
And
would be the bicarbonate?
bicarbonate
Yes.
within normal range.
It would be normal. Okay. So
Yeah.
in which condition, type 1 or type 2 respiratory depression or failure, bicarbonate level would be normal?
Yes, yes.
In which one? Respiratory failure 1 or respiratory?
Uncompensated.
No.
Partially, ma'am.
In which one? My question is
Partially compensated, ma'am.
type 1 or type 2?
Type 1.
Yes, type 1. And there is compensation. When compensation
Yes,
occurs in acute respiratory acidosis, we are not going to just memorize it, we are going to understand it. Okay,
yes.
what is the role of kidneys? How do they regulate acid-base balance in these sort of situations?
Yes, in this scenario, the kidney takes time, 3 to 5 days to
Yes,
start the acid-base balance. Here they
yes,
uh, excrete the hydrogen ion from the proximal tubules and reabsorb the bicarbonate. Here.
very good. Okay, please tell me, right. How much should be the normal dose of morphine which should have been given
Yes,
post-operatively?
ma'am, it's 0.5 to 2 milligram bolus.
Okay. And what are the other complications that can occur as a result of morphine overdose?
Yes, patient may having the constipation, confusion, nausea, vomiting, skin rash, hypotension, respiratory depression.
Things have gone beyond that. There is, okay, pulmonary edema, cardiac arrest. Things can
Ma'am,
go
you
further.
use the morphine,
Yes, with morphine overdose.
naloxone, naloxone the pulmonary edema, ma'am.
No, no, no. I'm asking
Okay,
morphine
okay, okay,
overdose.
okay, ma'am, okay,
You're, I think, yes, maybe
yes.
my question was not clear to you. Okay, right. Please tell me, how should a pain be managed post-operatively as a surgeon? What do you know?
Yes, here I involve the multidisciplinary approach, the uh, specialist surgeon, anesthetist, and the pain team, and follow the review the drug chart and the follow the who painkiller step ladder pattern here.
World Health
And also I
Organization.
consider
World
the
Health
patient
Organ.
control anesthesia.
Okay, what does this WHO's or World Health Organization's
Yes, ma'am.
pain ladder
Yes,
states?
it's first the mild, moderate, severe. Mild the paracetamol, NSAID. Moderate is the weak opioids, that is the codeine, and the third is the strong opioids, that's the morphine.
Okay, please tell me where this carbon dioxide retention takes place.
Here the central chemoreceptors in the ventral aspect of the medulla oblongata.
Which enzyme is required?
Oh, carbonic anhydrase, ma'am.
Yes, and this enzyme is present where?
The red blood cell.
All right, okay. Okay, please tell me what mechanism is involved.
Yes,
Actually, they
yes,
can ask you about
it's
the,
a cellular metabolism that we get the carbon dioxide which travels to the capillary bloods, and here with the bloods and carbonic hydrates is from the carbonic acid, and from where the bicarbonate moves out in the cell and the chlorides enters into the cell, that is the chloride ship. And against when it enters the alveoli, chlorides moves out and the
out
bicarbonate
where?
enters
Out where? In plasma.
outside the cell, RBC.
Yes, yes, outside the cell
Bicarbonate
into the
enters
plasma. And hydrogen enters
with
and
the
binds with
hydrogen,
the
yes, ma'am,
hemoglobin.
binds the carbonic acid, then spilled into carbon dioxide and water, and the carbon dioxide expelled with the alveoli.
Please tell me what is chloride shift?
Yes, ma'am. When the chloride diffuse into the enters the RBC, and the bicarbonate moves out from the red cell, and the maintain the cellular balance. That is the chloride shift,
Where
and
are
it
the
occurs in the red
senses?
blood cell.
Yes, thank you. Where are the senses located which sense hypercarbia?
The two central chemoreceptor and the peripheral chemoreceptor, ma'am.
Which are
Central is the
close
pons
to,
and
yes.
medulla. Periphery is the carotid and aortic, carotid body and aortic sinus.
Okay. Okay, why partial pressure of oxygen remains in normal range and why there is no metabolic compensation in this scenario?
Yes, ma'am. If there is 60%, that is the 0.6. It's the
60%
normal.
what?
The, friction FiO2, ma'am.
Okay, there is 60%, then what happens?
Then it's the 0.6, it's the within normal range.
Yes, this is
And
basically FiO2 is according to ventilator.
yes, ma'am.
Yes. So what happens?
And
You'll adjust it accordingly, and then what happens? Then there'll be no metabolic compensation because acute kidney
takes time.
Takes approximately 3 to 4 days.
3 to 4
act.
days.
Yes, that's why there is no metabolic compensation. Okay, good. Thank you.
Thank you.